I think that, within my organization, just talking about some of the pushback that I've gotten, our first one with the nurses, there was a lot of pushback. There's a lot of fear, right? Well, what if it says something wrong and then I could lose my license, or we could do something wrong with the member? And I said, hey, we'll go slow and we'll work with you hand in hand. So actually we pulled 2 clinical RNs from that team, kind of super users, and they built the prompt with us. They wrote it with us. And we took them and went to the team and said, don't listen to me, listen to them. They're nurses. They do the same job as you, and they're finding tremendous value and accuracy out of this prompt.
Hi, I'm Boaz Ashkenazy. I'm excited that you're tuning in to the Shift AI podcast, a show that explores what it takes to thrive and adapt to the changing workplace in the digital age of AI and agentic systems. In today's episode, I'm thrilled to have Alex Waddell as our guest. Alex is the Chief Information Officer at Adobe Population Health, where he leads technology initiatives aimed at transforming healthcare delivery for vulnerable populations. If you're someone interested in how AI is being used in healthcare to reduce costs, improve care, and remove barriers like food insecurity and transportation, you are not going to want to miss this episode. This is going to be a great show, and we're super excited to talk to Alex today. Can't wait to learn more from him. Let's get to it. All right, Alex, welcome to the Shift AI podcast. Thank you for coming on. We're here in Dreamforce in San Francisco, Dreamforce 2025. Tell the audience a little bit about yourself and who you work for and why you're here.
Yep. So my name is Alex Waddell. I'm the Chief Information Officer at Adobe Population Health. I've been building electronic medical records on the Salesforce platform for about 10 years now, almost. Started out as an admin, worked my way up, certified application architect, and then now the CIO. So at Adobe Population Health, we partner with Medicare and Medicaid plans to provide population health case management in the home. So we're kind of like a benefit of the insurance plan. We help our members navigate the healthcare space. So if they have one of the plans that have us, we will contact them post-discharge, make sure they're getting home from the hospital, they understand what they need to do, how to avoid that from happening again. We focus on what are called social determinants of health. These are the socioeconomic issues that plague our community, like food insecurities, medication adherence, transportation barriers, stuff that gets in the way of care. If you can't buy food, you're probably not going to pick up your meds. So we help people find food banks in their communities. We'll drop off food for them. We'll pick them up peanut butter and jelly to get through the day. Whatever it is to help them overcome those challenges and hopefully stay out of the hospital and reduce healthcare costs for themselves and for the overall industry.
And where are you based?
We're based in Phoenix, Arizona.
Gotcha.
Yep.
And so what are the technical challenges that you faced kind of, leading up to the CIO position, but also just in general?
Yeah.
And then let's try to link that back to AI and what's happening right now, and especially in the highly regulated industry of the medical industry. Talk to us a little bit about what are some of the things you're up against.
Yeah. So I think the first challenge, especially when it comes to population health, is there's not really an electronic medical record out there that can do it. Population health is a new thing. It's kind of the buzzword now, but 8 years ago when we started, it was brand new. And so because there wasn't an EMR out there that could do what we needed it to in the way that we wanted to, we got the Salesforce platform and built our own electronic medical records. So the first kind of goal for us was to set a foundation, a platform, a cloud platform that can actually do population health case management, make a difference. As we've scaled, data has been a huge problem for us, not internally, but we work with so many different payers now that, you're getting your eligibility files in different formats, your reporting requirements are different. We have to integrate with more external entities like health exchanges that are out there. So now we have this custom EMR, but we're not necessarily on the FHIR standards or HL7 or something like that. So having to translate back and forth has been difficult. We leverage MuleSoft to support us with that. And now going into the future, we've got a great platform that we like, that works for us and our outcomes. We've got the ability to move the data and transform it, but now we've kind of got the issue of, the system is just getting in the way of care, right? Electronic medical records aren't really the thing that make a difference in people's lives, right? You collect a data point that says they're diabetic. How does that really serve them in the end? Maybe downstream, there's some, analysis that's done at the plan and they give them benefits. But so when we're thinking about artificial intelligence in our organization, it's really about getting the system out of the way. So you've got the platform, you got the places to put the data. How can we leverage AI to either pull from that and provide summarization or quick, help with note taking, because notes are a big problem. But we do these 200 question forms, and you still have to come to the bottom and write a essay on everything you just said
Right.
above, right?
Yeah.
Well, if I have the question that says they smoke, 2 packs a day,
I should know that.
You should just be able to press a button and have it go into the
Always
note.
The frustration when you go back to the doctor's office.
Right, and then you ask the same question over and over again, right? So the historical summary, getting information, it just got to the point where, I was hearing from clinicians saying, like, I know this isn't your fault, but I have to, I would rather spend 15 minutes in the home educating on something, a chronic condition, or finding them a food bank, but I have to go sit in my car before my next visit and finish charting because, obviously as an organization, we demand that. CMS demands that. So, if I can use AI for anything, it's to ensure that they're focusing on that human that's right in front of them.
Absolutely.
And making a difference in their life. Because again, an EMR is it's not the thing that makes a difference.
Yeah, we hear from doctors all the time about the homework that they have to do and the note-taking they have to do. You can alleviate 20% of that.
Yep.
Huge
proportion of it. Yeah, I want them to focus on being with their families or, watching a TV show and not charting until 8 p.m.
Yeah.
And then getting back to work and doing 10 more visits and over again. That causes burnout. And, it may not be avoidable necessarily no matter what EMR you have, but because we have Salesforce and the platform, we can leverage automation in ways that other people can't. We can access data through MuleSoft in ways that other people can't, and we can leverage AI.
Was that part of the decision to do it yourself? I mean, you could have chosen one of the big EMR monoliths, but you decided not to. Was that a difficult decision?
Well, so I was very, very young when that decision was made. I was just starting. It was actually my mentor and our current CEO that made that decision. He's a technologist and kind of said, hey, Salesforce has this new thing, Lightning, that's coming out. We're way beyond that now, right, at Dreamforce, but that was a big thing. And, my CEO was a registered nurse in hospital systems and at the biggest meat plant in the United States somewhere in the Midwest or something. And they both said, yeah, there's nothing out there that can really do this. So let's go at it ourselves. And I just was lucky enough to know them and I was working at a restaurant and he said, hey, do you want to join me? So I said, sure, why not?
Yeah.
It's always been a difficult thing. I get to different stages and I question whether or not, are we still doing this right? At 12 employees, Salesforce was very, very expensive. And it was always the question, should we be on this or should we go with something way cheaper? Then we get to the point where it made sense. And then now we're at 450 employees and we're growing very, very fast. And I'm going, well, can my system keep up? Are we keeping up with regulations? Should I move to Health Cloud? Should I move to another system? But luckily, I talk to people within the community and they say, hey, if it's working for you, keep going. Are
you excited about the new things? I know Voice is talked about this morning. There's other ways of personalization. Yeah. What are some of the things that you're most excited about in this next phase?
Voice is incredible. We have some contractual limitations on how much we can use Voice, but I think Voice makes a lot of sense for things like reminder calls. Mm-hmm. Why would I have my call center staff making reminder calls, leaving voicemail when I could have AI help me with that? I'm really excited. It's not so much on the end user side, but I think it will benefit them as the vibe things that are happening. As a developer and as an admin myself, I'm looking at it going, gosh, you guys don't even know where I came from. There was no documentation. It was nothing but message boards. So being able to build applications, objects, things like that by talking to a prompt
is going
to allow me to deliver for my staff and for our members better solutions at a quicker pace with better scale. And so I think there'll be some huge downstream benefits to that. We're a pilot customer for the Grid solution that just came out. And we're really excited about that, being able to not only test your prompts at scales, makes it so that we can deliver those quicker, but we're actually using it for a quality assurance use case. So we built a audit checker, basically, all the things that we're audited on from a case management perspective, and it will read the chart, hundreds of charts at a time, and let us know what's, do they pass? Do they fail? What score do they get? And that's really beneficial for us because our clinical leadership spends a lot of time just, okay, I'm going to go look at this assessment, then I got to poke around the chart, pull up 2 screens. Well, it's like, and you're getting a false sense of either failure or success because the 20 charts you picked that week, maybe they were good, maybe they were bad. You're not really getting a holistic approach. So I'm really excited about Grid. We're already using it. I think it's going to be huge for Salesforce customers and their customers.
It's such an interesting space, relatively speaking. So much of the people that I talk to, it's about efficiency and it's about profit. And that's amazing. Mm-hmm. But it seems like in the healthcare business, there's the AI in general, not just in clinics, but with drug discovery. And it just seems like that's going to have the biggest impact on people.
Absolutely.
So when you think about the future and you get excited from a technologist standpoint about what is to come, Like, what are some of the things that really bring you energy?
Really excited about AI's ability to give our clinicians the right data at the right time. Making the right decision for that person could be the difference between, chronically being in the hospital and eventually on hospice, or living a healthier, happier life. So being, at my first day at Adobe, I, got to go on ride-alongs, and I got to see the real world impacts of, one home was just, hey, I fell and I live in a great house. My wife's here to take care of me. And then you have other homes where it was a completely different story, a different level. And so for me, I think that what excites me the most in healthcare is the opportunity that AI can have to deliver outcomes to help us make better decisions. Because in healthcare, we have real world impact in people's lives. So no offense to anyone selling a t-shirt. I'm not selling a t-shirt here. We're trying to make people healthier. We're trying to make sure they're home, they're going to their churches, they're going to their community events, they can go to their nephew's, party that it is, and not stuck in a hospital for the last 10 years of their life. So I think that's a huge opportunity, and everyone should be leveraging Salesforce in some capacity if you want to enable this type of change.
So I always ask the same question at the end of the show. And I think this one is like particularly interesting because it is something that is hugely impactful on people's health. But if you think about the future of AI and you think about two words to describe it, the future of work, what would those two words be? And how would you can elaborate?
Augmented intelligence, I think is what I would say.
Tell me more about that.
Because, I'll give you a mild little story. I was at a conference. It was a health exchange conference. These are basically state, organizations that all the hospital systems are supposed to be putting their data in to overcome the interoperability problem. So there were doctors up there, one after another, and they were saying, it's so great. I can go in there and I can pull the discharge PDF and read it and to find information. And it is great. It's incredible, but it does also highlight how far behind healthcare is, because they're not talking about leveraging AI. They're just saying, hey, I'm happy to just get access to something that was in a different part of the healthcare system. And while I was there, I got a chance to talk to one of the speakers, and he was a doctor, so he's a little scared of AI. But I told him, I said, well, what if you could have an agent that could tap into that health exchange and find the information that you wanted? Because the discharge paperwork could be 30 pages long. Getting your hands on it is one thing. Actually finding what you need out of it is another. So being able to process that amount of information, understand, okay, I've got this person in here for, they had a heart attack or what they assumed to be a heart attack. I want to be able to compile the historical information and get context out of it that would help me diagnose them more effectively and put them on the right medication. I think that that's going to change the game, and we're not going to take the doctors out of it ever, right? You're never going to take, in my opinion, I don't think you'll ever take the human out of healthcare.
That's the augmented piece.
That's the augmented piece. Exactly. Exactly. And so that's what I'm really most excited for. I just want my staff to have access to all of the information in Salesforce without having to search for it. Maybe an agent that can help them put information in the right places so they don't have to go and put it there and waste time, and really truly care. I think we're at a place where we can actually maybe have a doctor not touching a computer at all, and they're just communicating with you and making that real world difference. So.
One thing that really struck me this morning in the keynote was, and then also in the press conference, Mark Benioff said it again, was about adoption. His job right now is to make sure the technology is moving fast, but we get the people to adopt. You must be feeling that.
Yes.
And so talk a little bit about that. Maybe that's like kind of the final thing. Like, how do you envision this thing coming together where the doctors and the nurses and all the people that are involved can adopt in ways that can be meaningful?
I was just having this conversation with somebody else, and it's a difficult task when you talk about the entire healthcare space, because we're all in different places. Some people are still charting on paper. We still use faxes, right? Technology has not necessarily been adopted in every space. I think that, within my organization, just talking about some of the pushback that I've gotten in the agent force and prompt builder use cases that I've implemented. Our first one with the nurses, there was a lot of pushback. There's a lot of fear, right? Well, what if it says something wrong and then I could lose my license, or we could do something wrong with the member? And I said, hey, we'll go slow and we'll work with you hand in hand. So actually we pulled 2 clinical RNs from that team, kind of super users, and they built the prompt with us. They wrote it with us. And we went to them, we took them and went to the team and said, don't listen to me, listen to them. They're nurses. They do the same job as you, and they're finding tremendous value and accuracy out of this prompt. How we do that on a larger scale, I think, is maybe a little more difficult, but it's showing the success that companies like Adobe Population Health is having, the strategic advantage that it gives us, and making sure that they understand They're not going to take your job, right?
Yeah.
No one can take the doctor away.
Are you guys publishing some of the stuff that you're doing? Adobe Population Health, but also you, like how can the audience learn more about what you guys are doing and then get in touch with you too?
Yeah, so my CEO has published a few articles on our outcomes, how proving that if we can solve the social determinants of health, we can reduce overall healthcare costs for the plans. Myself, I've written for Forbes a few times.
Great.
I've had a few articles as well. I do a lot of podcasts, so not a lot. I think you're like my third, but I'm looking forward to doing a lot more. I speak at Dreamforce every year. So if, obviously you can go to my LinkedIn or our website, adobepophealth.com. We have a news or media space where you can look at myself, my CEO, our CFO, talking about the organization and the great things that we do.
Awesome. Well, I'm excited about this space, and it's really interesting to see the impact that you guys are having on the population. So, Alex, thank you for being on the Shift AI podcast.
Thank you for having me.
And I look forward to following you.
Appreciate you.
All right.
Thank you.
That's a wrap. Thanks for tuning in. Such a pleasure to have Alex Waddell as our guest on today's episode. Alex brings a powerful lens into how healthcare organizations can leverage AI, data integration, and automation to remove friction from care delivery and drive better outcomes for vulnerable populations. His perspective on augmented intelligence, clinical empowerment, and thoughtful AI adoption is a must-listen for any healthcare innovator. If you want to stay connected to Alex, you can find him on LinkedIn. And if you're interested in how he thinks about the evolving healthcare landscape, definitely connect with him and keep up with his posts and activities online. I continue to be amazed by the guests we've had on the show, and I'm excited about the ones joining us in the near future. I truly appreciate you spending your time with us. Thank you for listening to this episode, and don't forget to subscribe to the Shift AI podcast for more exciting interviews, and please follow me on LinkedIn for updates on how AI can help you scale your business. The Shift AI podcast is syndicated by GeekWire, and our show's theme music was created by Dave Angel.